Good evening, everyone. My name is Caitlin Holland, and I'm the president of the Shoals Chamber of Commerce, and we are thrilled that you have joined us this evening for the State of Healthcare in the Shoals event. This is almost 1 year exactly from the start of what has been a life-changing year for many of us, and it has certainly been a changing year for the Shoals area. We would typically be having a celebration tonight, an annual meeting, gathering hundreds of our area citizens together to celebrate the Citizen of the Year, to have a speaker, to enjoy dinner together, and to celebrate local business. But tonight is, of course, a bit different. So instead, we are gathering with you virtually. We have a great panel with us tonight. I'd like to thank each of them for being here. Buchanan, president of Helen, Keller Hospital; Russell Pigg, CEO of North Alabama Medical Center; Dr. Vicki Pierce, dean of the Anderson College of Nursing and Health Professions at the University of North Alabama; Dr. Karen Landers, assistant state health officer, Alabama Department of Public Health; Dr. Mackey will be joining us shortly. He is the state superintendent of education; and Ms. Britt, president of the Business Council of Alabama. I'd also like to take this time to thank those who made tonight possible: our sponsors, the Diabetes and Wellness Clinic of the Shoals, Helen Keller Hospital, the University of North Alabama, and Alliance Cancer Care. We appreciate each of you for your support. Before we go any further with tonight's event, we would like to celebrate our Citizens of the Year. And this is always something that we look forward to doing. And this year it was a unanimous decision, an idea that was brought to us by our past presidents, and one that we are thrilled to accommodate. We actually have 2 Citizens of the Year awards to present that represent numerous people that have gotten us through a very difficult year for the Shoals. And I'm thankful to have Helen here to accept these awards. But our 2 awards go to the doctors, nurses, and staff of North Alabama Medical Center and Helen Keller Hospital. And if you guys would like to say a few words on behalf of your staff, we would love to hear from you.
So I guess I'll show this while I'm doing this. I guess I'll just say I appreciate this. I think it's well deserved, not on my part, but on the part of North Alabama Medical Center and Shoals Hospital as well, our doctors, our nurses, all of our staff. I'll tell you a little bit more about it when I speak later, but the hospital's been right in the middle of this with Dr. Landers, and she's a part of this as well. And we're here to support the community, and it's what we're supposed to do. So thank you very much.
To echo similar sentiments, thank you all so much. Helen Keller Hospital has been fortunate to play this role for our community. It's been a beneficiary of so much support. So we want to extend thanks not only for my staff, but also to the greater community. Thank you.
I'd also like to thank, before we start, Olivia Bradford with the Shoals Chamber of Commerce for her tireless efforts in organizing tonight's event. This was really her brainchild, and we're excited to finally be here putting this on for our community. We look forward to hopefully next year having hundreds of you in a room again, but for tonight, we are very grateful for this panel and the information that they will share with you and for your attendance tonight. So without further ado, I would like to turn it over to Buchanan, president of Helen Keller Hospital.
Good evening. Thank you to the Chamber first for that wonderful award and for hosting this event. I'm a little bit biased. I think healthcare is, because of the nature of what we do and what we see, of paramount importance to the community. I think over the past year that has been really highlighted. But you put us in somewhat of a dilemma, folks like Dr. Landers, myself, Dean Pierce, Russell. Our lives, Katie, everyone, has been turned upside down over the past year, and you have challenged us to talk about it for 10 minutes. So I'm going to do my best to stay within that time frame, but I want to make sure we cover some really important points. All right, so we really look at COVID as an inflection point. So we have BC, before COVID, was one life, and then now during or after COVID. Before COVID, we, as many businesses in the Shoals across North Alabama, were in growth mode. So many of our initiatives that we had looked forward to for several years, we were able to kick off in 2019 and 2020. Our surgery was busier than ever. New ventures launched, new renovations, and we were getting ready to celebrate what we thought would be a fantastic 100th birthday in 2021. Well, then April 24th of 2020 happened. That's when we received our first COVID patient. Came in the form of a patient who was transferred to our ER from a neighboring facility who was tested negative in their ER. Worked up, thought the patient may have had the flu or some other respiratory condition, and brought that patient to us to assess. That particular patient was worked up, treated, and we found out several hours later, at 9:18 specifically, that person was indeed COVID positive, and that launched our journey that we are almost a year into. 1,114 COVID ER visits and 834 COVID inpatients later. We assumed at that moment we were in for a 90-day process. Little did we know a year from now, we will mark that as really the beginning of a new era of healthcare. So what do we learn? One, science works. So science has evolved, and as we've learned more about this particular virus, we have changed how we do things in healthcare and in business. PPE absolutely works. There's no denying what we've experienced at our facility and other hospitals across the country and in any organization, that wearing masks, social distancing, some of the things that we've learned is absolutely work. We've had over 413,000 staff interactions with patients. So in a COVID positive patient, 413,000 times one of our staff members have come in contact with them. Of those interactions, only 6 have been confirmed to have transmitted COVID from that patient. 124 have contracted COVID, we think from some other source, particularly someone who's positive at home. But we put all of that together, that's 0.03% transmission rate. That's phenomenal. That's what, when we launched this process, we hope that we could establish within our hospital and also share across our community. Number 2, the Shoals is God's country. And I don't mean to offend anyone from any other part of the country, Birmingham, any other state, Montgomery, the Wiregrass. We love y'all too. But this community has rallied around each other in ways that we didn't even think possible a year ago. Things like our charge nurse in our IDU, which is where we keep our sickest patients, worked 7 shifts straight Christmas time, which we saw all the spikes across our state. And when she made it home that night, she had a Christmas card from a 2nd grader saying, "Merry Christmas, thank you for what you're doing in our community." Those types of things, in addition to the pizzas and all the food that flooded our doors and gifts, that goes so far in helping build our staff and build our community as a whole. Our local community of healthcare providers also became stronger, I think. There are some patients and subspecialties that historically, when a patient would arrive of some type in our ER, we would contact Vanderbilt and we find a subspecialist there and we transfer that patient there for that particular disease. Well, when Vanderbilt and UAB and the likes were all full during COVID, we had to find new creative ways to take care of patients and keep those patients here in the Shoals. And part of what we did in that process was become stronger and become more comfortable dealing with more critical situations that historically we wouldn't have had to deal with. And also community-wide interdependency. We have had conversations, not just Russell and I and Dr. Landers and others in the healthcare world and Dean Pierce, also individuals who would not call my cell phone. Case in point, local mayor called the week after Christmas and said, "We were hoping to launch youth basketball next week. And we saw you and Russell in the newspaper saying you've got more COVID patients than ever. Do you think it's wise to delay that several weeks?" And so those types of conversations among community leaders, among churches, schools, and others, when it boils down to it, is something we really need to hang on to after COVID. So what's next? I often hear the term new normal. I like to stay away from the word normal. I don't think things will ever be normal as we understand that term to be. just as, and I use this analogy and I don't use it lightly, just as air travel before 9/11 was very different from now, I think we'll have that same type of inflection point in healthcare. And healthcare prior to COVID would be very different from healthcare after COVID. We've also learned that protection is absolutely critical. When we think about driving business, we think about driving commerce, we think about schools, we think about all the things that make our communities vibrant and active. Protecting ourselves and finding ways to do it safely is critical. We all know that with this virus, we can see ebbs and flows of volume. If we find ways to protect ourselves through vaccinations and others, it's absolutely critical. Case in point, flu season. We have virtually seen no flu season this year. And it behooves us to do more study into why we've had to close 0 schools or classes due to flu outbreaks, which is a pretty common thing in our community. Through how we protected ourselves from COVID, we've simply eradicated that need. So how do we package that and make sure we do that every year going forward to protect ourselves from even the flu? And these are some things, opportunities, I like to call them opportunities, really things that we haven't done well. So racial and SES disparities continue to exist. So a few examples. In our state, more women die from cervical cancer than any other state, minus Arkansas. That's a commonly screened cancer through pap smears and vaccinations. We don't have optimal access to that in our state, long been the case. Second, more Black women, 4 to 5 times more Black women die during or after childbirth in the state of Alabama than white women. That's not okay. What COVID did is it took what we thought were small disparities in very specific areas, and it brought them to the surface in a very painful way. So when we deal with COVID patients and we deal with the sickest COVID patients, more often than not, they're Black, brown, and or obese. That's not okay. And as a healthcare community, we have to really attack that and be honest with ourselves to say that's something we have to fix. Speaking of fixing, Medicaid expansion has long been a conversation in our state. We have still hundreds of thousands of people who don't qualify for Medicaid but can't afford commercial insurance. That gap has been covered in many states. Many states, that gap coverage has allowed them to react to COVID in a more agile way. That's something that we think across our state we need to continue to work to fix. Numbers 3, 4, and 5 are important. Mental health, mental health, mental health. The pandemic has brought through isolation, through trauma, through other avenues, mental health issues that we've never seen before. I can tell you in the past month, we've had many more young people in our ER than we would have seen in a typical March. And we think that's a direct result of what they've been through over the past year, and maybe even not seeking those services because of COVID. If we don't find ways across our state to fix and adequately fund mental health, many of the things that we fixed through the pandemic and protect ourselves, we will literally shift those issues to mental health problems. We don't find ways to fix that proactively. Not to end on a very sour note, but that is essentially where we are as a hospital. We are very excited to be at this point in the pandemic. We hope the worst is behind us, but continue to look forward to the next steps. Thank y'all.
All right, good evening, everybody. Thanks, Kyle. Again, my name is Russell Pigg. I'm the CEO at North Alabama Medical Center and Shoals Hospital as well, or North Alabama Shoals Hospital, I guess I should say. First, I just want to say thanks again to the Chamber for recognizing the hospital. The first thing on my list was just a big thank you to our nurses and our physicians and our hospital staff. They really have been heroes over the past year, and a couple of just quick examples. Think about the nurse that works on our COVID units, but she goes home and takes care of her parents at home. You know, she's risking not only her livelihood and her life and her health, but also the lives of her family members at home. A lot of our staff had to make some of those decisions, and I can tell you they came to the hospital and took care of people, which is that's their calling. We had one of my neighbors actually in my neighborhood. She's a nurse, and she took care of my other next door neighbor. And he came by the house and said, "Thank you." He said, you know, our neighbor took care of me and I was a COVID patient, which I didn't even know. But he had taken care of her for a week in the hospital. And just kind of an example of how the community took care of the community. And I think that's, again, what the hospital's mission is. Some lessons learned from the pandemic, just like Kyle mentioned earlier. I think number one, healthcare has been humbled. And we've all learned we're not the makers of this world and God's in control. And he kind of showed us who's boss, right? But we had to adapt at the same time. And over the last year, at our height, we had 85 COVID inpatients, and today we have 5. So that's good news to share in the community that COVID has abated a lot. We learned a lot about cleanliness and hygiene, safe patient handling. In our hospital, we were lucky enough to have an extra unit, so we shut down some of our other units and put COVID patients on just floors where we keep COVID patients segregated from everybody else. That seemed to work well, so we could keep our well patients, if you want to call it that, in the hospital, away from our COVID that were sick patients. We took care of almost 1,000 COVID patients in the hospital as inpatients over the last year. Countless ER visits. We tested 24,000 people for COVID. A lot of them had it, unfortunately. But again, we're very blessed to have a brand new hospital that we're in, and moving around floors and being able to expand and contract the patient and the community need was important for us. We also were able to send some of our hospital patients to our sister hospital, Shoals. They opened up a rehab unit. We were able to treat post-COVID patients and get them the rehab they needed to recover. The trick there, and I'm sure Kyle would echo the same thing, this trick there though is taking care of all the COVID while you're also taking care of other patients in the community. So taking care of heart attacks and strokes and other very sick patients at the same time, keeping them separate from COVID patients and make sure you don't have cross-contamination. That was something that we learned a lot about, but we also do that pre-COVID as well. But I wanted to make sure that we made the point, make sure if you're having a medical emergency, come to the hospital. We can take care of sick patients with COVID and sick patients without COVID. So that's what the hospital's job is. Right now, though, what we're focused on as COVID is stepping down, as I mentioned earlier, right now we're just focused on getting shots in arms and working with Dr. Landers on that, arm in arm, so to speak. But we've gotten over 10,000 shots in arms, which is, I think, great. We've expanded our visitor policy. One of the main things at the hospital that our patients' families have expressed displeasure in is we want to be able to go see our loved ones. So now we're letting more patients into the hospital to visit with their loved ones. We've returned our floors that were COVID patients back to their med-surg or surgical capacities. We don't need a dedicated COVID floor now just for the few patients that we have. We've also had volunteers come back. We had our first set of volunteers come back today, in fact. So our volunteers are welcomed back into the hospital. We're going to ask people mask and do social distancing and keep hand hygiene in place. That's always going to be important. But we're letting people back into the hospital. And if we do have another surge of COVID, we'll work closely with the state, our hospital, and our board, and our medical staff. And we may go through some of the same exercises that we've asked. Looking forward to the rest of this year, though, we're sanitizing the hospital on a daily basis to make sure it's safe to come into. We're hiring nurses. We have 44 nurses that we're going to hire over the next couple of months to make sure we're staffed up for the summer and winter. We expect people to come back to the hospital and get their elective procedures done again, and we'll need the staff to be able to accommodate that. We've opened up elective surgery 100%. We've opened up our outpatient services as well, so people can come back to the hospital for the things they need to get taken care of. Our physician offices are all open and doing normal business hours again. And as we look forward down the rest of the year, in December, we open up a brand new cancer center on campus, so we can take care of oncology patients on campus. And that's a regional cancer center that's designed to serve the whole community. And then again, I just want to make sure we stress here, we still hear stories. In fact, my aunt wanted to come to the hospital a couple weeks ago. She might not be happy with me telling this story, but she was afraid to come to the hospital. And I said, if you need to come to the hospital, we'll take good care of you. So she's actually home now. But if you need to come to the hospital, come to the hospital. We're ready to take care of heart attacks and strokes and COVID all at the same time. Thank you very much.
tried to go to speaker. This is Kyle as the speaker. And we're back.
Good evening. I'm Vicki Pierce. I'm Dean of the Anderson College of Nursing and Health Professions. And I want to thank Olivia Bradford and the Shoals Chamber of Commerce for planning tonight's event. And it's an honor to participate and a pleasure to host the event in Loram Harrison Hall here on the campus of UNA. I've been asked to talk about tonight about how COVID-19 pandemic has affected UNA and the College of Nursing. And, you know, the pandemic has greatly affected higher education all across the country. Many states have had COVID-19 restrictions and stay-at-home orders in place, and those orders have affected college campuses. Students haven't been able to live on campus, and they haven't been able to attend class face-to-face, and so enrollment across the country has declined in many universities, and severe financial losses have been experienced. There have been many who have experienced pay cuts, furloughs, and employment cutbacks. According to an article in the Chronicle of Higher Education in February of this year, approximately 650,000 higher education employees have lost their job in 2020. Thankfully, that is not true here at UNA. Thanks to the leadership of President Ken Kitts and Provost Ross Alexander, UNA has experienced minimal economic losses. General enrollment has not decreased, and we have not experienced pay cuts or furloughs. In fact, because of growth of our graduate programs, our enrollment in UNA is actually up 5%, so that's phenomenal. When the pandemic began, President Kitts developed a COVID-19 response task force to oversee the process of keeping our campus and community safe here through UNA. Throughout the pandemic, the task force has followed the guidelines set forth by the Alabama Department of Public Health and the Centers for Disease Control and Prevention. And they've communicated changes and safety guidelines and measures to our students, faculty, and staff on a regular basis. Some typical changes that have taken place here on campus have been things that you've seen in churches and communities and schools. Increased cleanliness measures, social distancing, mandatory wearing of masks on campus, limitations of large gatherings, and initially our face-to-face classes moved to an online format. University assisted students, faculty, and staff with these measures when we were all working and learning from home by providing technology and resources to help us with that and training as necessary. Last fall, instruction in our classes moved to more of a hybrid format and students came back to campus, although class sizes were limited to half the capacity of the room space. Throughout the pandemic, some students have continued to live on campus and the university has provided food and their masks and also healthcare services to those students. As for our nursing education program, it's really been difficult on nursing education as some of the hospitals were forced to allow us to not come into their facilities. This is really due in part because we were trying to prevent the spread of disease and there just simply wasn't enough PPE available for students and faculty and the hospital staff. So students were kept from going into the hospital facilities and nursing homes initially. But the Anderson College of Nursing and Health Professions set out to develop a academic interruption plan to help guide us through this time. We used the guidelines that were set forth by the COVID-19 Response Task Force here at UNA, also the American Association of Colleges of Nursing and the Alabama Board of Nursing to develop this plan. And our plan was approved by the Board of Nursing last spring. The plan outlines for a process of converting our face-to-face courses to online format and identifies alternative simulated clinical learning experiences that we could use instead of going into hospital clinicals. Last spring, we made this transition quite smoothly because most all of our faculty had already taught online and our students had participated in online classes in some format or another. Perhaps our biggest challenge was was providing enough clinical experiences outside of hospitals for all of our students during the pandemic when we couldn't go into the hospital. But thanks to moving into Loring Harrison Hall and this beautiful facility that we now have, we were able to provide enough simulated clinical learning experiences to make up that difference. We also started placing orders for PPE, and as soon as those products became available to our students and faculty, and the hospitals were able to open back up, we began moving back into the hospital setting. This fall, we were able to be primarily in the hospital settings, and now in the spring semester, we're back full-time in the hospitals, working alongside those nurses there in the hospital. This spring, our faculty and students were able to receive the COVID-19 vaccine, and many have chosen to receive it. Our students and faculty have also been administering the vaccine throughout the community at different hospitals and here on the campus of UNA as well. In spite of the many challenges, I'm pleased to let you know that there were no real deficits of our nursing students this year. As you know, nursing students must complete, after they complete their education program, they must pass the NCLEX exam. And this year, in 2020, our NCLEX pass rate was 98.1% in spite of all the setbacks and limitations we had because of COVID. And this is fantastic because it's actually significantly higher than the state and national average, which are both below 90%. The state and national average dropped, but here at UNA, our NCLEX pass rate actually increased. So I think that we've experienced a lot of setbacks because of COVID, but we're stronger for it. In September, all 3 of our nursing programs successfully completed the Commission on Collegiate Nursing accreditation evaluation, and we anticipate having full accreditation status later on this semester. In October, we moved into this facility, and in December, our first graduating class of nurse practitioner students and also our postmaster certificate students also graduated. Enrollment in our programs is strong and it continues to grow. And we are currently advertising for 2 brand new faculty because of the growth that we're experiencing in the college. So while the pandemic has been difficult, it has taught us some valuable lessons. I think we've all become better at innovation. We're constantly learning new ways to do things that we've done before, but we're doing them better. We discovered new and effective ways to teach and learn. Both our students and our faculty have done that. And we've also become more experienced at problem solving. It seemed like every day there was a brand new problem that was coming up and we learned to problem solve better. And hopefully we've all become a little more compassionate and understanding as we've worked with many people who have experienced loss, grief, and severe anxiety during the pandemic. So I thank you for the remaining, for working with us. I thank the hospitals for working with us, and I thank our state leadership for providing excellent guidance. More lines.
Thank you so much for having me tonight and for the opportunity to speak to this group. I mean, certainly it's a real privilege to be able to do this. Sorry, I had to do this just the way I learned it in Ebola school. People say Ebola school. I said, yeah, you know, you've been around a long time when you've been to Ebola school, and all kinds of other places that I've been that, you know, someday that'll be a different story. I really want to frame our speaking tonight. I also learned that in Ebola school. I want to frame our speaking tonight by just looking back on what happened in January of 2020 and recognizing that when there was discussion about SARS-CoV-2, you know, I've been around long enough to know about SARS, you know, SARS-1, as we like to say, SARS-CoV-1. But to remember that when this really came about, there were some things that we knew, but there was a lot that we did not know. And I certainly agree with Mr. Pigg that I think medicine has been humbled in this year But I think, as Kyle said, it's been a great opportunity for us to learn. And as one of my friends who's a pulmonologist and an infectious disease physician, and well, that's a combination, said, you know, if this weren't so deadly, it would have been fascinating. So I just think learning about the science has been something that has been a necessity in what we do. It has certainly been a very, very, very steep learning curve, and I don't think speaking about drinking from a fire hydrant could come anywhere close to this. As I remind people, science was the first thing I did every morning and the last thing I did every night, because having to be able to keep up with what is going on in terms of the management of the diagnosis, the interpretation, the new testing, everything that was coming out, you just really had to stay abreast of that. And of course, in the meantime, I did not intend to become the face of the Alabama Department of Public Health, but apparently in my line of work, I get things that no one else wanted, and so, you know, bam, you're it. But I want to frame this from the standpoint of saying I do think the Shoals area has been a real treasure for me to work with. You know, I live in this area, even though I work for the state health department, so I get to work with 67 counties in the state, but it's been a real treasure and a real privilege to work with the entire Shoals area. Dr. Pierce, Mr. Pigg, Russ, and Kyle, obviously, from Keller. All of the hospitals have been so great to work with. I have my Kyle and Russell phone. You know, that's the one that, I mean, I know when I need to talk with one of them. I want to talk about reminding everyone that we have had almost 9,000 cases of COVID in Lauderdale County. We've had 216 persons who are no longer with us as a result of COVID. We have a little over 6,000 cases in Colbert County that occurred, and regrettably lost 125 people. And at our peak in Lauderdale County, we were having about 23% of every, you know, all the tests that we performed were positive. And that was just astounding to think about. You know, in Colbert County, we had about 27% at any given time. And of course, we did a regional testing clinic. As Kyle knows, we first started out in collaboration with Helen Keller Hospital on that testing clinic. We started out, it was really cold out there. Then we went through the summer and we went through the fall, and then, you know, we paused for a bit, then went back, and, you know, it was cold again. But I remind people that we didn't miss a day out there at that clinic except Memorial Day and the 4th of July. And so it was quite a successful effort. We're very pleased that our percent positivity, at least at the moment, in Lauderdale County, is probably right at 3%, and Colbert County right at 6%. Those are good numbers. I'll take them. But I remind people that we need to remain with our mitigation standards. And I would recite them, but everyone knows them better than I do. Or you better know the mitigation standards. There will be a test at the end of this. I want to talk about vaccine for a moment, and I also want to acknowledge that with any effort of this nature, something that's unprecedented, something that has not been done in 100 years, you know, there will be success and there will be challenges, but there will not be failure. There will not be failure, because that is not an option, if I might borrow from the movies. And just to say that we've certainly had our share of criticism in the Alabama Department of Health about what we have done, but we have remained laser focused on taking care of patients and promoting and protecting the health of the citizens of the state of Alabama. And as I said a few weeks ago, I was being interviewed by a television station. I said, you know, I've had some kind of rough things said to me during COVID-19, but if that helped people, then I'm okay about that. So in talking about vaccine, let me just acknowledge that, you know, we've had some attention that maybe our rollout might not have been as fast as some other states. But I do want to remind people that we've not lost a dose of COVID vaccine in Alabama yet, okay? And so, you know, while our percentages may have been a little lower in terms of the overall percent population early, if you look at some of our other parameters, we're actually pretty high. So we've done a very, very, very good job with vaccination in the state of Alabama. And we have followed CDC guidance, and we're getting where we need to be. We have 3 products right now, as you well know. 2 of them are the mRNA vaccines, the Pfizer vaccine and the Mrna vaccine. They're very, very similar, and really, I like to remind them is the messenger RNA, they bring in a little message They give a little message to the cells about making I call it a fake spike protein, and then the body recognizes this fake spike protein and says, I believe I'll make antibodies. And then the little messenger's like a Post-it note. You've taken care of it, you throw it away in the garbage, except in the health department, we put it in the shredder because it's protected information. But the mRNA vaccines both work very, very well. The efficacy of the mRNA vaccines approaches over 90%. These are 2-dose vaccines. They are not interchangeable products. They do have a minimum interval, Pfizer being 21 days and Moderna being 28 days. When we started out with these, frankly, nothing against Pfizer, but that vaccine is just a little ticky to handle when it comes to the cold chain requirements. And that's why I have pictures of everybody's refrigerators and freezers on my phone. So, if anyone wants to see pictures of freezers and refrigerators, I've got them from many, many places. But again, recognizing that, once we got these products in, we're starting to use them. Again, 21 days for Pfizer, 28 days for Moderna. They're very good products. They're not interchangeable, but the efficacy really is comparable. The side effect profile with both of them, I remind people you've probably got a 50 to 80% chance of having a mild side effect like a sore arm or a little bit of redness. And then you probably have a 50 to 80% chance of having one of the side effects such as fever or chills or muscle aches or fatigue, just not feeling terribly well. Now, I'm going to tell you that my daughter is an ER doctor in the United States Navy, and she took Mrna, and the first time she had a little fever and chill with it. The second time she had a lot of fever and chills with it. And she said her main side effect was gratitude, okay? Because obviously working in an ER and every other week she worked COVID 10, she said her main side effect was gratitude. I remind people say, well, are these vaccines safe? Well, my daughter took it and I took it. We're both still here. So, I'm saying, I think from my standpoint, it's pretty safe. We have noticed with both of the vaccines, there is a slightly increased risk of anaphylaxis over the general risk of anaphylaxis in the population, but the overall management of this has been very successful. All of our clinics are set up to manage anaphylaxis, and we do feel like that overall risk is certainly still less than COVID-19. I will mention the J&J vaccine. We don't have a lot of J&J vaccine in Alabama. We got a grand total of 40,000 doses, and almost all of those have already been given. Now, again, the thing about J&J is I like the fact that it's a single dose. I do think the efficacy is good, although some of the data indicates it to be lower than the mRNA vaccines. But if you look in terms of the hospitalizations or in terms of severe disease, it's really comparable. And so people ask me, which one would you take? I take the one that's available at the time it's available. Again, except for being a single dose vaccine, I really, I don't think there's any advantage, over one versus the other. I do know some people wanted J&J, and, we would like to have more, but that's what we have at the moment. And again, it is a single dose vaccine. Now, what do we mean by when people are fully vaccinated with vaccines? Well, again, according to the CDC, people are considered fully vaccinated if they've had 2 of the mRNA vaccines and they're 2 weeks post-vaccine. With the Johnson & Johnson, it is 2 weeks post the single dose. We've not had a problem in Alabama, and I think it's really, really good. Mr. Pigg and I were talking about this, returning for the second dose, but believe it or not, if you look at the CDC data, we are very high on people coming back for the second dose in our state, so we're very pleased with that. And certainly we remind people that we like to give dose on the minimum interval. A few weeks ago we had a snowstorm. It's okay to delay the vaccine after the 21 or the 28 days. CDC has data up to 42 days. And I tell people after that, we will still give the vaccine if the person comes in. But we do not hold that second dose. If you don't come in by the time you need it, at least in the Alabama Department of Public Health, we have to move on. As far as, if you don't come in for your second dose, after 42 days, we're gonna give it to someone else. We had our high week this past week with over 171,000 doses given in the state of Alabama. And at least as of this morning, 816,000 people in Alabama had had at least 1 dose of COVID vaccine. And probably by tomorrow, when our data goes up, we'll have well over 500,000 people that have had both doses. So what does this really mean to the Shoals area? And I had someone ask me, well, when is the county level data going up? Soon. And someone said, well, how soon is that? Very soon. As soon as our IT people can get it posted. But we do expect it very, very soon. But I can give you a little bit of county data about the Shoals area. And I do want to commend our 2 hospitals as vaccinators and as partners with the Alabama Department of Public Health, along with UNA working with us. And again, there are other entities that have vaccine locally, but of course, you know, we have the most, obviously, the health departments, the hospitals, and the college here. So we have the most vaccine. Colbert County is number 14 in the state for the percentage of people vaccinated at 22.8%. Lauderdale County is number 16 at 22.6%. So you see it's very, very, very close. And I will also throw in, because Franklin County is part of the Shoals, Franklin County is number 26 at 21.6%. So again, the Shoals area is looking very, very good in terms of vaccine. We also are very pleased that the retail pharmacies have come on board, Walmart and CVS. We're very pleased. We do not have control over where those stores choose to have vaccine. We can suggest, but we do not have control, and that was one of the issues that we had initially. Well, why didn't my Walmart get it, or my Walmart? Again, we don't control that. You know, that's a federal program, but we're very, very pleased that even though we do not control that, they are certainly partners, and we're very, very pleased to have them. As far as our long-term care facilities, our federal long-term care partnership was very successful with Walgreens in vaccinating our long-term care residents statewide. So we feel that's been very successful, and we've continued to work with Walgreens. CVS was part of that. I think they might be stepping back because they're getting more involved in the partnerships in the community, as I think Walgreens will be. One of the final points that I would like to make in terms of vaccination, and again, I'm just old enough to have paper notes here because I talk about a lot of stuff every day. But one of the final points I would like to make in vaccination is, even though we're vaccinating, we know there are still a lot of people who want to be vaccinated and need to be vaccinated. And I would urge people to certainly be patient. Vaccine is coming, but right now we get between 110 and 120,000 doses a week. And that seems like a lot, but it's really not, because most of this is 2 doses. Got to vaccinate people twice. And also to keep in mind, in addition to that, that 3 months ago, I mean, today is March the 16th, 3 months ago, we were vaccinating our first person in the state of Alabama. And we were getting 40 to 50,000 doses. So we have come a long way. We are still working to get more vaccine in. There are a lot of efforts in the state of Alabama. There are a lot of efforts around equity in the state of Alabama. And certainly we look forward to sharing those. As Dr. Harris already shares on our media, we will be sharing more information related to that. In closing, I would just like to say, again, the Shoals area, as I said, it's been a real jewel to work with here. It's been a real pleasure to work with everyone here. There has not been a time when we needed to collaborate, whether it's collaboration on testing, whether it was collaboration on getting a patient into the hospital. I myself have handled a caseload of COVID patients. I have had over 1,000 COVID patients myself that I had to take care of in terms of telemedicine outpatients, because they were uninsured or underinsured, and those that I had to arrange to have to go in the hospital or at least be seen in the ER. You know, both of these gentlemen here, I have not had one bit of trouble. I picked up the phone, I called the ER, and they said, well, send them on, you know, or be sure to tell them wear a mask. I said, I'm the health department. I wrote the book on mask. But seriously, it has been, again, a great privilege, and I think things are becoming much more clear now. I think we are seeing the light at the end of a very long tunnel, and over the next several weeks, so we will continue to ramp up our vaccine efforts so that we will become some level of a different normal. I don't know what that normal will be, but I don't think we will abandon a lot of practices that we've carried forward. But I think we will be strengthened and we will come out of this on the other side. So thank you very much for allowing me to speak about this today.
Unmute. Hey guys, make sure that we've had time to get this started. I think it's started now. And I appreciate that. It's also been good to hear from Dr. Landers. Dr. Landers, I can't see you now because I know you stepped away from the podium. And I'm sorry I'm not up there in the shows with you guys, but there was just no way I could do that today. But I feel like we have this new connection now. I know how to take off my mask appropriately, and I did not have to go to Ebola school for that. But Dr. Landers and I have been kind of a running show at times, and it's always good to listen to updates from her, and it's good to get to follow her. And it's especially good to know the great work that she is doing, and her colleagues here, Dr. Harris and Dr. McIntyre. I mean, they have been true heroes for this state. And everybody working over there at the Department of Public Health has been a hero, to my opinion, this past year. In fact, I don't know how we would have gotten through the last 366 days if our Department of Public Health had not just dug in and said, you know, as an agency, and an Alabama agency, and we're all Alabamians, and we know that we do not overfund our public agencies, and public health is one of those. I mean, they have struggled at times with different things, but they have absolutely mastered the COVID situation, I believe, in supporting our communities and helping people through it. So my great appreciation to you, and Dr. Pierce, I also got to hear you, and I appreciate that. I'm sorry I missed the earlier speakers before that, but look forward to giving you a little update on our schools and where we are, and then hearing from Katie Britt also, I know, after me. So I'm going to share my screen. I have a little bit of a PowerPoint. There's not too much on it, but just a little bit. But I've got to get to my screen share. And give me a minute. And thank you all. Start this slideshow, and I think you all should be able to see it now. So brief introduction to myself. I just started talking, but I'm Eric Mackey, State Superintendent of Education. I've been in this role now for almost 3 years. And of course, just about 2 years into it's when we hit the big slowdown because of COVID, which was really difficult, has been in many ways the most challenging and difficult year of my life. And I'm sure, again, Dr. Landers and many others would say it's been the most challenging and difficult year of their lives, certainly their professional lives, in so many ways. And yet, in a way, it has also been an eye-opening experience. And I think that we have learned some things this year that will take us through the decade to come. I really do believe that. I think that is as sad as it has been. I have personally lost friends. I have personally had friends that spent time in the hospital, but at the same time, we have learned through this, and we certainly are understanding better how to manage some things going forward than we were doing in the past. And there are some things that we all want to go back to normal. We all want to feel that basketball gymnasium. I know, again, Dr. Landers, I've heard her talk before about her children, and basketball was a big part of their life. And, you know, sports is a big part of all of our lives. We want to go back to that normal experience. But at the same time, I hope that we all understand that we appreciate those experiences more in the future. And secondly, as I get into my presentation, I hope we learned something from this past year. And I'm going to give you a quick example before I jump into our first slide. And that is, when I say we learned something, so we're going to talk a little bit about academics. We should learn certainly academics, but we should also learn some new behaviors around public health and taking care of ourselves. I was at a ceremony during this past year, during the time that we've been dealing with COVID, and everybody at the ceremony was doing what they were supposed to do. They were wearing masks. They were seated in family groups, 6 feet apart. People were not shaking hands. They were not doing high fives, all the things that we asked them to do. And yet I saw everybody who was walking up into the bleachers grabbed that handrail. I'm going to lift my hand. It's really down here. But they grabbed that handrail and every person slid their hand up that rail as they were walking to their seat. Well, we certainly know there's, of course, nothing against using a handrail, but that in many ways undid all the other safety precautions that people had put in place. And unless they're carrying some hand sanitizer, and I have seen people and have done that myself. So what can we do? What kinds of things can we do that help us in the future? And the reason I mention that is, even though, again, it's been awful to deal with COVID this year, in public schools, we have seen our lowest incidence of flu in a long time. And I want to say probably in my whole career, the lowest incidence of flu that we have had. I cannot remember a year that we did not have to close schools down because of flu outbreaks. And we've not had any of that situation this year. Well, I know that there are lots of epidemiological issues for that, but I would have to attribute some of that to us just doing a better job this year with personal hygiene, keeping our hands clean, certainly wearing the mask, the distance, keeping our rooms. We're doing a better job cleaning our classrooms and gymnasiums and other things than we have in the past. So that's what I mean by, I hope that we learn some things from this, because we lose collectively across the state. If you take every child and all the days we lose to the flu, we lose thousands of days, hear me now, of days of instruction every year because of influenza. And so if we have learned some things that will help us lower the prevalence of the flu in the future, and certainly, of course, we hope lower the prevalence of COVID-19 and other diseases, then it will help us instructionally. So I hope that, again, we've learned some things even from this past dreadful year. I'm going to hit a couple of slides here. I won't spend but a second on vaccinations because Dr. Landers has already done a great job covering that. Public Health's been a wonderful partner with vaccinations, but I will tell you this, our teacher vaccinations appear to be running a little bit higher than the general public. And we appreciate Public Health and their helping us make sure that we had access to vaccines. In many communities, teachers are they're kind of standing in line with everyone else, if you would, like Montgomery County. They've had a huge drive-through clinic, and many of our teachers, hundreds of teachers, went through that drive-through clinic. We've now been able to work with Public Health and Alabama State University to do a dedicated teacher clinic in Montgomery for teachers that were not able to go through the drive-through clinic. In other places, communities have been able to set up just a dedicated day or a clinic just for their teachers. And when I say teachers, I mean all of the adults that work in our schools, bus drivers, cafeteria workers, administrators, and others too. But these kinds of clinics have helped us, again, to get ahead of the curve and ahead of the vaccination rate for the state. Now, I don't have exact numbers. People every day want to know what our exact numbers are for vaccination. And obviously, because of HIPAA, we cannot require teachers to report that. What we do know is when we have one of those dedicated teacher clinics, how many of our adults in schools come through the clinic. And it's somewhere above 20,000 teachers now that we're pretty sure have had at least the first dose of vaccine. Some of them still have to get the second dose, but by the 1st of April, we should be above 20% of our teachers being fully vaccinated. And of course, every day we're getting more teachers getting the first dose of vaccine. So I really believe that we will have all of our teachers who want the vaccine vaccinated by the end of this school year. And I can't guarantee that. And certainly something could happen to our supply lines even, but we believe we're on track for that to happen. I'm an old high school physics and chemistry teacher. I'm a strong believer in the science behind it. And I've had the vaccine. I've been fortunate to be able to have both doses now. I had a little bit of reaction to that second dose, but I told people I'd rather be tired and feel kind of achy for a day than what I've seen folks go through who had a bad case of COVID. So we're excited about that. Again, most of our teachers and adults should be vaccinated, we believe, by the end of this school year. So what does that take us into? So we talk about the road to recovery, and what does the summer and the fall look like? So first of all, I'll address masks. We have been following the governor's directive on masks all year long, and we continue to do that. So when the mask mandate is lifted on April 9th, assuming that nothing changes, then the mask mandate for schools will also lift on April 9th. We're working under the governor's order. Local school boards, however, do have the discretion, as they have always had, to make rules, pertaining to dress, if you will. So even so, some schools have uniforms and some don't. Well, they can make the mask a mandatory part of that, if you will, school uniform. They can require the mask if they want to. And I do think we have some local school boards that are going to do that. And we have some that are not. And we have some, I think most are not. Let me say that clearly. From the ones I've heard from, I'm going to say the vast majority are not going to require it. We have some that are looking at hybrid models, where they might say we're going to require the mask in the classroom, but we're not going to require it outside. Or we're not going to require it in the classroom, but we're going to require it just in the hallway. So they're looking at those things. I've been all year long saying we will support local superintendents and principals who make the best decisions on the ground for their students with the best information they have. But as far as a statewide order, we will cease to have a mask order for schools when it ceases for the rest of the state. And again, I do believe that most of our schools are going to follow suit with that. And so we're hoping with this good spring weather, and if our numbers continue to go down, that we'll have a more normal looking end of the school year as we get into summer. There are going to be a lot of summer programs this year. We do have summer school starting up. We have summer reading camps. A great program for young readers called ASAP will be going on this summer. So we will have a lot of summer programming going on at our schools. We still don't know for sure what some of that summer programming will look like, because we don't know when the 6:15 rule might be relaxed and some of those things. So right now we have to plan as if they were to be in place. But some of those things obviously could get relaxed, as we just all have to follow the numbers and follow the science and what it tells us to do. Now, as we move into the fall, I think we'll look even more normal. I think everybody knows I went to UA myself for a graduate school, and I don't know if the folks watching are Auburn fans or Alabama fans. I know there are a lot of UNA fans. But it doesn't matter where you want to go. I know everybody paid attention when UA announced that they would go to regular seating for this fall's football games. So we think that we'll be able to do that too. Our plan and intention is certainly that we would go back again to regular seating at football games. Things would look normal again. And that's what we're planning for. But at the same time, we all have to be mindful of what comes along. I'm going to go back to my flu incidents. So we always plan for school to go on, other than this year, and in the normal fashion. But every year we have a dozen schools or more that have to shut down because of a flu outbreak. And the flu just gets so prevalent that they have to shut down for a few days. We have to, sometimes not have basketball games because of flu prevalence. So we could get in a situation, we understand that, where we might have some closures during certain times. We really don't know what that looks like yet. I think we're going to be relying on Dr. Landers and Dr. Harris and their team quite a bit for making some of those determinations about what the fall could look like. But on a normal school day, our anticipation is that the vast majority of our children will be in a classroom in a more normal looking situation, going through a more normal daily routine. And the key to that for schools is that we get all those teachers vaccinated, because the spread of the disease among children is out there, but at the same time, we don't see as many severe symptoms and cases among children. Feel pretty good about that. And I don't want to downplay, we have had some children that have been seriously ill. We've had children in the ICU rooms across this state, and we have lost some children's lives for COVID-19. So I never want to downplay one child who has to spend a night at Children's Hospital, or one child whose life is lost. It's one too many. But at the same time, there have been very few of those children, and most children who've been diagnosed with COVID-19 have had either very minor symptoms or no symptoms at all. So we believe that as we go into the fall, if we can get our adults vaccinated, we'll be able to handle the COVID-19 in our schools. I want to just say a couple of other things. I'm going to go quickly through this, but I think all of you know that our schools are due a lot of federal money. And so I wanted to put this up. So CARES Round 1 is what we call it. But that's money that came in the first CARES package that was passed by Congress last April. I think April 27th is when that became law. And so you see under that light blue bubble that we have CARES Round 1 money. That middle group of money has all been spent or is very close to being spent. There is actually money still for the ABC for Students program, which is a voucher program that pays for internet service that runs through ADECA, but we've been working with that. And that money will be it'll run out by this June. So we do have money, thanks to Governor Ivey's leadership, to carry that program through this school year. The GEAR money is money that came from the governor that's gone out to our schools. Most of that has been spent or has been allocated, because a lot of it is for before and after school tutoring and summer school. And much of that will be spent during this coming summer and fall, but it's already been allocated for those expenses. The $216 million in ESSER 1, that went directly to the schools. It was spread on the Title I formula. So the higher poverty incidence there is in a school, the more money the school got. And then you see that all that came up to about $2 billion, a little over $2 billion that went either to our schools directly, to our schools through the governor's office, or to our parents through ADECA. So a large amount of money. I'm sorry, I shouldn't have said that, because that 1.8 billion actually was all the state's money from CARES 1. We only got about 170 million from for schools. So it came to, I think, about a half, I said almost 2 billion, but it was actually $500 million, I think, a little less than that. So if you look over then where the red bubble is, we got CARES 2 money. This money has still not been distributed to our schools. It was passed by Congress in December, signed by the president December 27th. And that was President Trump's last big act, of course. And we got $67 million in GEAR 2. It's a little bit different because there's money in there for private schools. For the first time, our department is administering that money on behalf of the governor, working with private schools across the state to administer that money. It's a little bit complicated. It's not just writing a check to the private schools. There's a lot of federal accounting that goes along with it. And some of the private schools are not interested in the federal government being in their books and get, inside their schools. But then we do have others that are interested and want the money. So we're working through that. You see in that kind of dark green, forest looking green, $899 million that passes through to our schools through the department. We are asking every school district to complete an application for that money. So they have to tell us, really write a 3-year plan, a 30-month plan for how they're going to deal with learning loss among their students, thinking about things like high quality professional development, high quality instructional materials, summer school, after school, accelerated tutoring, and those sort of things, and put together a plan. Those plans are due to our department by June 1st, and then that money will start being spent later this spring and into the summer, and it can be spent all the way through September of 2023. That little gray box at the bottom, the FCC has just announced how some of that money is going to be spent. I don't quite have a handle on that yet, but that's money that'll go through the Federal Communications Commission to give students access to broadband or to internet at home. We think that some of that will be used as a voucher program too, but don't have exact, the specifics on that yet. So I want to go now to this last pot of money. So ESSER 3 is President Biden's first big bill. And I think everybody knows that the American Rescue Plan was passed. It will be $2 billion for Alabama schools. So you see that the pot's growing. That first pot was $216 million. The second was $899. And then this one is into the billions. So $2 billion. Now this money, we don't even have. I put a few things up about how it can be spent. We know it has another year. It can be spent through September of 2024. But we don't have one piece of official guidance from the United States Department of Education yet. Obviously we've been able to read the bill. Our partners in Washington have helped us to digest the bill, and so we have some round things we understand about it, but without any real guidance from Washington, we're not even really talking about the distribution of that money yet. The districts all want to know how much money they're getting. I was on the phone with the superintendent at 5:30 tonight, talking about how much money is this district going to get. Well, we really don't know because we don't even have our state allocation yet. We know it's going to be about $2 billion, but it's just a little bit over $2 billion actually, but we don't have the official state allocations, and therefore we can't get the official local school district applications. I will tell you this, we know that the poorest school districts in the state are going to get about $9,000, a little more than $9,000 per child. I think one gets about $9,400. And then the wealthiest school districts in the state will get about $700 per child. So there's a big swing in between. And again, it's based on that Title I rate and the official count that the federal government has and those kind of things. So we'll work on that. So that brings me to the end of my slides, and I'm going to turn it back over to the program. I do want to say again, thank you for letting me be a part of this. And thank you to all of our partners and friends in the Shoals for your support for our schools. Have not been to the Shoals except one time since COVID started. I was up there in October for a meeting actually in person, but I didn't go in any schools. But the year before, I spent several days in the Florence schools and have been in other schools in the Shoals area on both sides of the river. You have some great things going on in communities all across the Shoals. But this has been a trying and challenging year, and I hope you'll continue to support those superintendents and those classroom teachers and school nurses, the front office secretaries, all the people who make school work, because it's tough in any year, but it has been really, really tough this year. But we've got people who are doing not just good work, but they're doing heroic work, in my opinion, keeping our schools operating and open during this time. And again, looking forward, I promise you, there is nobody more looking forward to going to a baseball game than I. But we've got to be mindful that we are still in the midst of a worldwide pandemic. Things are better, but we're not out of this tunnel yet. Thank you again for all your time, and I will turn it back over to the program.
Hello. It's so nice to be with you all. I realize that I am standing in between you and dinner, so I will keep this as tight as possible here. I just want to say thank you to Caitlin for having us. Thank you for the work that the Chamber does. I know that you have been instrumental in making sure that this community continues to thrive and people and products are able to move around, and really appreciate your continued leadership. Also want to say thank you to the healthcare community. I mean, you all have been the front lines. You and the people that you represent have kept us safe, have kept us, I guess, have gotten us to where we are today. And so we want to say thank you. I mean, obviously at the university and at the Department of Public Health, you've done a tremendous job. And then Dr. Mackey, who joined us virtually, and all that he's done to keep our children in the classroom and our children learning. On behalf of the hardworking Alabamians across the state, thank you. We appreciate all that you've done. I'll tell you, when I came into BCA 2 years ago, so a little bit over 2 years ago, I really wanted to make sure that we refocused. Coming from kind of my Wiregrass roots, look at that, I'm calling you your brother now, as Kyle alluded to earlier, wanted to make sure that we started looking at small business and rural communities, and how do we bring people together to move Alabama forward. Well, we really got put to the test to see if we were worth what we were talking about during COVID. I'll tell you, the moment that COVID started, we redirected our resources, making them available to all businesses and all people across the state. One of the things we did as the first CARES Act package was passed, we were asked a lot of questions. We found that some of our larger companies and maybe more established businesses had maybe in-house counsels or had accountants that were able to say, okay, this is how you pull down PPP dollars, and this is what you need to do, and these are the documents that you need to get together. It was our small businesses, some of the people who keep our main street moving, that were having challenges figuring out what all they needed to do and how to get in line. I'll tell you, so the Business Council did what we called a small business exchange. So kind of your old school telethon, and got up there and did 2 days worth of phone lines open, and anybody who needed to bring your questions to us. And we had attorneys and accountants and bankers from all over the state ready and willing to answer questions. And we were able to therefore help thousands of Alabamians, not only by answering their questions, but helping them keep their doors open, helping to figure out how do we navigate this public health order. It was something that was wildly successful, and we were really proud to be a part of. You know, we moved on and continued those kinds of things throughout COVID. I'll tell you some of the other things that we did, where we went to the governor and talked to her about, hey, you know, how do we make sure that businesses and healthcare providers, and nurses and doctors and school teachers who are trying to do everything they can to keep their employees and their customers safe, how do we make sure that they're protected from frivolous lawsuits? And so we worked with her along with a coalition of other organizations to say, you know, let's get some liability protection on the books. And so we were really proud to be a part of her executive order, which we all know has turned into a piece of legislation. Senator Orr did a tremendous job, and Representative Faulkner. And so we were really pleased to be a large part of helping make that happen for not only the business community, but the healthcare community and our educators and our nonprofit entities across the state. Additionally, one thing that we also really pushed for was making sure that those dollars that we talked about that came down were not taxed from a state level. So obviously, as people are trying to, you know, they're getting their stimulus checks or they're getting the PPP funding, they're not thinking that they're going to have to pay taxes on that. So making sure that was rectified at the state level was something BCA was proud to be a part of. I'll say too, in addition to these things, you know, Small Business Exchange, Engage Alabama, all of that, we also saw a role for us to play with regards to the CARES Act dollars and how we could get those in small business owners' hands. So as those dollars came down, we advocated to the governor to make sure that we could get those in grants to businesses that really needed them across the state so they could keep their doors open. We found that small business across the state was incredibly innovative in how they got their products to people. I mean, we all saw social media presence step up and people learning how to safely deliver that or, you know, package it up and do home deliveries. And so this is people's livelihood. And we also realized the negative health consequences of a shutdown. You know, whether it's the mental health component of that or it's the lack of nutrition that's getting to school students. So we really wanted to make sure that those dollars went into small business owners' hands that really needed them, and that there was as least amount of regulation as possible, knowing that they would know how best to use those dollars, not the government. So we have worked kind of across the gamut, as you have seen in COVID, and also we launched a Keep Alabama Open initiative. And this was to remind people about personal responsibility, first and foremost, doing what you need to do to keep yourself and others safe, and then also advocating for us to be able to safely and responsibly keep our doors open. I'll tell you, all of this has been an incredible challenge, as you all have seen and you all have been on the front lines of, but like many of you, I am so proud of the innovative spirit, the resiliency that we have seen from our hardworking Alabamians across the state, and to what it's kind of exposed. As Kyle said earlier, things that we need to work on as a community. And one of those in particular that's been touched on, but is broadband. And so we looked at that from multiple levels. One, obviously businesses, you know, now if you look at, you need broadband to run a tractor effectively and to swipe a credit card, but also you need that for education. And these students who were at home and didn't have access to the quality they needed, the division between the have and the have-nots grew greater. And I'll tell you too, with telemedicine, we saw as people were unable to get to different places, the need to have access to that. So we will continue to advocate strongly for broadband, and as I know all of you will here as well. And we'll continue to work and build partnerships and work together. We are proud. One of the things that we've recently launched is a vaccine distribution task force. And that is something that's an internal working group that's working with the Department of Public Health, working with the governor's office to say, how can the business community step up and get more shots in arms? And so whatever that means and whatever we need to do, we have several large entities that want to house those and be a conduit for that. We have others that want to help make sure that their workforce has access to it. So we're answering a lot of questions and troubleshooting those and trying to be good partners moving forward. And while the pandemic is not over yet, please know that the business community stands ready to help and that we are incredibly grateful for all that the healthcare community has done to help keep Alabama open. Thank you.
I'd like to take this opportunity again to thank our sponsors for this evening, Diabetes and Wellness Clinic of the Shoals, Helen Keller Hospital, University of North Alabama, and Alliance Cancer Center, and also our panel, to Kyle, Russell, Dr. Pierce, Dr. Landers, Dr. Mackey, and Katie. Thank you for being here tonight, but thank you also for the role that each of you have played in getting our community through this year and what you're going to continue to do to get us through this pandemic. We're so grateful for the work that you've done. Tireless effort we know has been put in by each of you. So for those of you who've joined us tonight, thank you for being a part of this event. We are truly grateful that you've taken the time to join us. From here, we just ask that you thank those frontline workers who have been a part of the effort to get the Shoals through this year. Shop local. We would be remiss if we did not remind you to support the local businesses of the Shoals that have had a very difficult year and are looking for brighter days ahead. Let's help them get there. Spend those dollars locally, and we know that we will have a fantastic year going forward. So again, thank you for joining us tonight. On behalf of the Shoals Chamber staff, its board of directors, we thank you. We look forward to a wonderful 2021. Have a wonderful evening.